Association of American Physicians and Surgeons, Dr. Elizabeth Valide, who practices in Arizona and Texas. All right, good evening, doctor. What do you know of these kids walking around with dangerous communicable diseases?
Good evening, Judge. It's a pleasure to be with you. Thank you for addressing such a critical issue. We know from the reports from the Border Patrol that there's a high incidence of tuberculosis, of swine flu, chickenpox, measles, scabies, lice, many contagious diseases that are coming as invisible carriers with the people coming across the border now.
All right, but the role of the CDC, aren't they supposed to be telling us this so that we can prepare for this?
Yes, in my medical career, I have not seen the CDC be so strangely silent. Texas Department of Health and Public Health has actually sent out multiple alerts. I had 3 alerts just in one afternoon this past week. Arizona Public Health has been strangely silent as well, and yet my information comes from the Border Patrol. I received a copy of the union letter warning the Border Patrol agents of what they needed to do to reduce their risk, which I commend them for doing, but yet we're not hearing from the officials that are charged with the health and safety of the American public.
Are we facing a full-on public health crisis now, doctor?
Well, in my opinion, yes. I've spent the last 5 years doing medical projects in Central America and South America. In fact, I was only recently back from South America, and one of the things that's quite staggering is the fact that 75% of these illegal border crossers now are coming from countries other than Mexico, countries that have a high incidence of drug-resistant tuberculosis that is well known in Central America and South America. So we are seeing a new disease pattern. We're getting into the incubation period, beginning to run out. School is starting in a few weeks in Texas and Arizona, certainly. So you have crowded conditions, hot, humid conditions, unsanitary conditions, and you have people that are carriers of bacteria and virus and the other contagious diseases that have been reported. We already have Border Patrol agents that have tested positive for tuberculosis, and this is not a simple matter.